excited about our new program that we have called Pathfinder. Will help various businesses and people who want to have some innovations that want to work with the VA to bring those to fruition. And it's a time for that they can learn about how to navigate the VA system, because as we all know, sometimes we have some very complicated processes as we go through various paperwork as we're getting through the VA. It'll share details about the different services, and also it's a way for us to engage with those people who are wanting to do business with the VA, and it'll provide people with transparency as how to navigate and when they're soliciting or for these different programs or whatever they want to offer to the VA. It'll be a way for them to be able to see what's going on as they go through the process, and they'll have a direct point of contact in the VA to do that. Also, we want to talk about a little bit about low blood pressure and just get, low blood sugars, and talk to people about if your blood sugar is below 70, how to reach out and get some support for that. And we're just trying to do a campaign about that as well. So next thing I want to talk about toxic exposure information. You know, we have a lot of things going on with that, with the water situation and, Camp Lejeune, and just want to make sure that people have that information and are able to get any information that they may need for that. Also, here's our information for vaccines, and we also always like to offer mental health resources for any and all of our veterans and their family members. And that's, with that being said, that's all I have. Thank you.
Thank you so much. Next up, we have Renee Rader from Department of Health and Human Services. Welcome, Renee.
Thanks, everyone. It was a little hard finding my way in this afternoon, so I apologize for my lateness. I just have a couple of updates to give today. Let's see, I don't think that worked. Ah, there we go. So just some programmatic updates. I wanted to make sure you were all aware that recently the Department of Health and Human Services awarded almost $16 million in opioid settlement funds. That, of course, is not all of the opioid settlement funds that are coming to our state. Over the next several years, we will have a significant portion of funds also coming to the state, but we were able to, at the department, award that $16 million. So we funded 20 organizations, and those are focused on providing evidence-based treatment for people with opioid use disorders, with a specific focus on our justice-involved populations and also populations of people who have been hospitalized or are hospitalized for overdoses. It is also funding transportation pilots and employment pilots and housing, evidence-based housing. I know I was going to miss one. The other thing that I wanted to make sure you were aware of is that we recently awarded $20 million to 5 certified community behavioral health clinics. Those are clinics that provide treatment for the whole person. So these are available to people in communities regardless of their ability to pay, regardless of their age. And they can get their whole person health care there. So that would be their behavioral health services along with their physical health services. There's also crisis services embedded into those programs. And we are very much looking forward to seeing how those dollars grow in communities. I just wanted to also mention the 988 implementation, as was mentioned earlier. So 988 is the new dialing code that will replace the old suicide prevention helpline. This helpline is already up and running on July 16th. It's just going to switch to this new, easier to remember dialing code. And there is the code that veterans can press to get the help that they need specifically. The other thing I was going to say about that is that we are expecting that our call volume is going to increase by 30 to 40%. And so we've recently been awarded a federal grant to help boost up our staffing in the call center so that we can meet that additional demand. We're also investing in community crisis resources so that we can meet the needs of the people who are calling in as well. And then wanted to mention tailored plan implementation for those of you who are, who know about the LME-MCO system. That is our behavioral health care system, publicly funded behavioral health care system here in North Carolina. And that is going to be transitioned to a different type of managed care model on December 1st of this year. And we are continuing to do implementation activities. We are actually right now preparing to go out to the potential tailored plans and start their readiness reviews. So that's very exciting. There we go. Wanted to point out some upcoming funding opportunities. And before I start talking about that, I wanted to say that we are always interested in supporting our veteran serving organizations. So if you're aware of one that may be interested in some of these funding opportunities, please point them in the direction of our website. So we have about $6.75 million going into some criminal justice initiatives. One is an early diversion pilot program that will aim at keeping people out of prisons. It's going to, in jails, and it's going to look at co-responder models in the communities, things that mental health professionals can work with community responders and law enforcement to manage mental health crises so that people don't go into the criminal justice system. And then the other one is mental health treatment in jails. We do not have a good system for providing mental health treatment in jails right now, and so we are looking to expand that through this funding opportunity. We're also funding, just as an FYI, some collegiate recovery programs so that students in recovery at the various colleges across the state can get the support that they need and can participate in activities and housing in substance-free settings. Finally, we have $6 million that is going into workforce development initiatives. We are doing some addiction medicine fellowship programs. With those dollars, we are also going to expand our practitioner education program. So looking at embedding addiction practitioner education into curriculum for healthcare professionals. And the last thing I wanted to say, big announcement, of course, is that the COVID-19 vaccine is available to kids 6 months and older now. And that's it.
Thank you so much. Thank you, Renee. Lots of exciting opportunities out there. Oh, yes. Hold just a moment. Go ahead.
I think I've never been known to be very quiet, but there are a couple of things I'd like to mention. I'm very excited about all the VSOs across the nation that have really made a difference in pushing that toxic exposure issue. I don't think it would have happened as well as it did without an incredible amount of VSO members kicking in and doing their advocacy work. So that's number one, and thank you. You were very smart to hire Dr. Melton. I know him as Colonel Melton, and he did an absolutely wonderful job at WOMAC. So I'm very excited that he's come back home. Okay? I was happy to submit information about Vision 6. I sit on the MOA Board of Directors, and I work, I actually chair the Healthcare Committee, and so Renee Campos is the MOA representative, a real genius with VA, and she is like this with the VA. And so she had to submit information when she was presenting to Congress about the VA. And she included Vision 6. Because there were so many great things happening here. So it turned out to be really a good thing for North Carolina. I was excited about that. And I think across the nation, everybody's worried about healthcare workforce issues. I mean, being fried, being burned out, having a real time. We're nationally, having trouble and trying to take care of employees so they will stay with us because so many have chosen to leave the field. It's been tough. COVID has been really tough. So we've got a lot of things, and I'd love to be able to share them with you. There's some really great research that's being taken place at the University of Alabama, and we just had
Thank you so much for those comments. Mark Belos could not be with us today, so you're going to have to put up with me. What's going on now with the Winston-Salem VA Regional Office? They have telebenefits at the VA in Greenville and Wilmington Health Care Center. That means that if you are using the Wilmington or Greenville Health Care Center, you may go in and chat with someone at the Winston-Salem VA Regional Office about your benefits. I am a VSO, so I want you to go see a VSO first. We have a great team in Wilmington with the DMVA and county veteran service officers there, and in Greenville as well. So remember, go to milvets.nc.gov to find your local VSO. The telehealth benefits do provide service members, veterans, and their families with face-to-face opportunity to ask questions and interact with the VA office in Winston-Salem. So part of those benefits are service-connected disability, non-service-connected pension, that's for wartime veterans, widow's pension, burial memorial benefits, veterans readiness and employment services, which has really been beefed up lately. So if you're a veteran looking for a job or looking for training, you may want to look into the veterans readiness and employment services, VA home loans, education, and life insurance. To schedule a telebenefits appointment or to speak with those individuals at the Greenville and Wilmington Health Care Centers. What's coming up? So Veterans Benefits Live, VA in my town, Charlotte. I am now in Mecklenburg County. So August the 18th, 19th, and 20th. The VA Benefits Live is formerly known as the Veterans Experience Action Center, or VAC. They had one in Cary this year in March. They had a great turnout. We expect a lot of people. By Monday, I will make sure that Governor's Working Group page, the gwg.org page, has the information on the event, the flyer, and we also have a link that went live on Tuesday for vendors to sign up. Right now, we have that link set with a limit of 30 vendors, but I think we can probably go up to about 45. So if you have an organization that wants to come and set up a table, make sure to look for that link. We will also put that and have them put that on the milvets.nc.gov page. So you can find that information in those two places. There at the VAC, of course, we will have VA raters from the Winston-Salem VA regional office. Raters look at claims and make decisions on claims on the spot. Sometimes they're able to award individuals. I mean, we've seen veterans walk out with $200,000 in their account. So if you are a veteran who has a claim, who has had a CMP exam, who is ready for your claim to be rated, you can come and see us in Mecklenburg on these dates. Time is going to be from 9 to 3 each day. We always run over, but please come and see us at that event. There's a whole list of the resources that will be there. Anything you can think of that you might need as a veteran, we're going to try to find it for you that day. So come and see us. For your takeaways, just remember the telebenefits at the Greenville and Wilmington Healthcare Centers. I'm certain that they will work to get those in all of the healthcare centers and VA medical centers in the state. The Veterans Benefits Live, again, and the Winston-Salem Regional Office is open to the public. You can go up there and talk to, we have some really good friends up there at Public Contact. They work well with the VSOs in this state. We probably have the best relationship we've ever had with the Winston-Salem VA Regional Office, and we're so thankful for that. All right, Victor is also not here, so you get me again for NC Works and Veteran Services. 18,916 new jobs announced. That is awesome. We are so happy compared to 11,643 at the same time last year. In 2021, total 24,224 jobs were announced, so that's a huge jump. We're glad to see new work come in for our veterans. NC Job Ready, Governor Cooper's Workforce Development Initiative to ensure North Carolinians are ready for jobs of today and tomorrow. The framework is built around 3 key principles: skills and education attainment, employer leadership, and local innovation. All right, the NC Works Veterans Portal can be found at veterans.ncworks.gov. There, that online portal helps North Carolina veterans find jobs that leverage the critical skills and experience gained through military service. So if you are your skills now that you attain while you're in service, if you were a computer guru or if you worked on trucks, those skills can now translate to a job, a civilian job, and lots of careers in high-demand fields. Developed by the Department of Commerce, it is designed specifically with veterans in mind, and the NC Works Veterans Portal features tabs that provide quick access to employment services, job fairs, education, training opportunities, helpful tips, and other resources. The Hilton's Honors Military Program, if you are a veteran and you're going to, or you're transitioning military, going to another place to apply for a job, or you're going to a job fair, Hilton is going to help you with some with your stay. So make sure to check out Hilton Honors, the Hilton Military Honors Program. And they will help you save when you're going to another hometown. When we had our work job fair in Mecklenburg County, we had people from across the state and in other states. So that's really, really helpful for those of you looking for jobs. There's some more information about that. These will be in our slides on the North Carolina Governor's Working Group page, ncgwg.org. For a listing of all the NC Works Career Centers, just go to www.ncworks.gov, NC Job Ready, NC for Me, North Carolina Department of Commerce, and NC Works Veterans Portal are all listed there. You can click those links if you go in and download the slide program. All right, now we're going to have some regional updates from the Department of Military and Veterans Affairs. That organization is divided into 4 regions. Each region has 2 to 3 veteran service centers, 2 to 4 veteran service centers. And we also have a team at the Winston-Salem VA Regional Office who are all there to serve you. I still say we because I'm still part of the family. So, Terry, if you would, please.
All right, thanks again. Our 4 regional managers could not be here today, so I'm going to kind of go over their regions for you. Really, what I want you to get out of this is where they're at, what they're taking care of, and how many people they're taking care of that work with. So, first off, like Crystal said, 4 regions. They're all highlighted up here on the map. You can see region starting in the west. It's region 1, 2, 3, and 4 coming across. Sometimes our guys call themselves, mountain, Piedmont, coastal, triad, or triangle. But we usually just say regions 1, 2, 3, and 4. And like she said, and then Winston-Salem has the state service office, and of course the headquarters is in Raleigh. Region 1, big thing about this, 27 counties in the western part of the state. It goes all the way from the Tennessee, Georgia, South Carolina border, all the way to, what's the furthest, was that? Iredell County. So it goes all the way to Iredell County, north of Charlotte. So it doesn't get Mecklenburg, but it does get Iredell, and then everything else west of there, basically. So you see that from those guys. So here's a little bit of information about what's going on out there. A couple of things I'll highlight. $283,000 of monthly compensation. That's what they're That's what the veterans that live in that area that are receiving disability compensation are receiving monthly in that area. So, and that's just, those might be a little bit old. So as you see, almost $4 million a year just in VA compensation. The big number you'll catch off of that is the $1.3 million of retro payments. That's people that have had a claim adjudicated this year that have gone back in time, and the VA has paid that much money to them in lump sum over and above what their monthly compensation is going to be from today forward. As you see, the contacts, number of claims, veteran contacts, over 20,000 contacts. Now, our veteran service office out there, we have 3 service centers in that region, Canton, Hickory, and Morganton. We have about 10 employees between those 3 centers total. We have four veteran service officers in those 27 counties. Now, the counties also have service officers, but the state of North Carolina has 4 service officers to cover 27 counties and to assist with however they can assist those people getting work done out there. They have about 100,000 veterans that live in those 27 counties. So it kind of gives you a quick look at that number. Region 2, smaller region, only about 20 counties. Edison Platt is our regional manager there. He's based in Charlotte. We have 2 service centers, one in Charlotte and one in Clemens for that region. And as you can see, we get from Alamance County, we get down to Richmond County, up there in number 20, Allegheny, and number 18 is Gaston. So it's a very small sliver that basically the I-77 corridor and right around there. So that's their region. Okay, where did all that come from? We'll get out of all of this. Get me somewhere else. Oops. Ignore all of that. Sorry. Okay, let's go back. So we'll go to Region 3 now. Robert Johnson's our manager there. He's based down in Fayetteville. As you see, 25 counties. He's kind of got the Wake County, the Triangle area, goes all the way from South Carolina state line to Virginia state line, picks through this area all through here. You see he's got Granville County, Franklin, he gets up. He also goes down to the southeast corner of the state for Wilmington and those counties down in there. We once again have 3 veteran service centers in this region. We have Fayetteville, Raleigh, Garner, and Wilmington. We have 4 veteran service officers between those 3 centers to service these counties. There's about 200,000 veterans in this region because this does cover Cumberland County, which is Fayetteville and Fort Bragg, and it also gets over close to Wayne County. It gets to Harnett, and Wake County. So big region, very few service officers in this region, and so on. And you see a picture there. You'll see some of Robert's numbers. We'll go, here's his award tracking thing. You'll see some of the numbers in there. Talk about how many contacts, talk about how much money's going, but I can tell you these numbers are huge, so take a look at them and you'll see where all that's coming at you from. And Region 4, which is the northeast corner of North Carolina, gets the Outer Banks area, gets all of the Albemarle and Pamlico Sound area, and comes all the way back over toward Highway 77 or toward Interstate 95 north. 28 counties. Tony Lugo is our regional manager. He's based out of Kinston. We have 4 service centers in this region. We have Elizabeth City, Greenville, Wilson, and Kinston. Between those 4 centers, we have 6 veteran service officers. Their region has about 125,000 veterans that live in there. A lot of the Northeast is not quite as populated as some of the other parts of the state are. Big thing that they have here is a lot of their veterans in this part actually get medical care from Norfolk, Virginia, versus in North Carolina, because they're actually closer to the Norfolk VA Medical Center than they are to Durham, which is the next closest there. There is a healthcare center in Greenville. That's the biggest thing in that region, is the healthcare center in Greenville. You see some of Tony's information that he's dropped in there, what his folks are doing, and all that. So we've talked about, is that different? Is that y'all now?
It looks like it.
I think that's all of our quick update. I kind of give you a quick overview of that. I hope it helped some. I hope it knows there. www.milvets.nc.gov has a lot of this information on it. It certainly has the contact information for all of our veteran service centers. And, if you need one, or if you know somebody that needs one, please direct them to one of our service officers and let them provide that subject matter expertise that makes this program work the way it needs to. Thank you.
Thank you so much for that update. So just to piggyback a little bit on what he says, The NCDMVA also has a state training coordinator who accredits all of and trains all of the county veteran service officers. They also provide training for our county association. Lois Harvin Raven in Durham is the president of the North Carolina Association of County Veteran Service Officers, and we are glad to have her lead us, and we're looking forward to some more in-person training coming up soon. Would any of you, NC Serves, would you like to give an update? Dave Roddenberry, Blake, anyone? Before I close out for today? No? All right, so coming up in July, August, September, you'll be getting updates from the committees of the Governor's Working Group. If you are out there and you are interested in helping with benefits, because I'm the Benefits Committee Chair, please feel free to email me, and maybe you guys might put my email in the chat on Facebook. It is crystal.miller@mecklenburgcountync.gov. We are going to be meeting on the fourth Wednesday, or the last Wednesday of the month, so that it'll be the Wednesday after our Governor's Working Group, and we can make plans for what we're going to do in the coming month. Right now, we're looking at developing a brochure that is for all North Carolina benefits, the state benefits, as well as what our Winston-Salem VA Regional Office offers. Another note, just to let you all know, is that we are trying to kick back into gear the Governor's Challenge to Prevent Suicide. And we also have 2 programs in the state called Together with Veterans, which are rural suicide prevention programs. We're working closely with the VA. SAMHSA has invited the Mayor's Challenge in Mecklenburg and the Governor's Challenge to come up to Alexandria, Virginia, August 1st and 2nd. For an innovation conference, and we'll be talking about new ways to gain our momentum back in our suicide prevention program. So all of you are a part of that because you have resources for veterans. And now we will go to you. I'm going to pass the microphone around, let you introduce yourself with and what services you provide.